Welcome to AATS Mitral Conclave 2017. I'm thrilled to be joined by the author, the boss of the Mitral Conclave. David, fourth time you've done this. Incredible audience. What are your thoughts?
I'm amazed every year, every 2 years we put this meeting on. Randy, this is our fourth one.
Right.
This year we have 67 countries represented by over 1,300 attendees.
Right.
It's phenomenal. I'm so proud of that. And I think it reflects the reach of, one, the AATS, but also the interest in sharing among colleagues. You know, when you think about it, it's amazing. We have 1,300 people. We're talking about one valve inside the heart. And it shows you when you bring all the world leaders together in a forum where you can really share different ideas and learn from each other.
And agree to disagree.
What can happen, and agree to disagree. That's one of the fun parts of this meeting. It's a very interactive meeting. So I'm very proud of that interaction.
David, the educational value is phenomenal. But I also think that the attendees go away with a new appreciation of how they might surgically approach the mitral and tricuspid apparatus.
And one of the visions for our meeting was to rely heavily on video and didactic.
Right.
And I think that this particular field, because reconstruction is really three-dimensional, it's really important to see videos and have strategy explained. And I think that the way we build this program is by asking the world leaders to sort of bring their latest concepts and theories and actually show and explain them, not just to report results. And I think that's always been one of the strengths of this meeting and something I'm very proud of.
Well, you did that this morning, I know, in the opening session where you had people talking about their strategy, and I thought that was dynamite. Transcatheter therapies coming along. This meeting's got a lot of that in it. It used to be a surgical meeting, now it's a...
Randy, it's amazing. If I go back and look at the program from 2015, I think we had one lunch session with 4 talks and 1 plenary session on transcatheter therapy. 2 years later, we had multiple abstracts accepted on various techniques with transcatheter repair, beating heart transapical repair, and of course we have a lot of information available on the emerging field of transcatheter mitral valve replacement.
Correct.
So this meeting is going to continue to evolve as the field evolves, and with so much attention on transcatheter approaches and beating heart approaches to mitral valve intervention, it'll be fun to watch, see what this program looks like in 2 or 3 years.
You know, you said it this morning, and a couple of the other speakers did, the real emphasis on this meeting is the best quality of approach to the patient with mitral regurgitation or mitral valve disease. So it's the patient first, not the technique per se.
Yeah, I'm very proud of the concept we developed here, that all schools of reconstruction would be represented, whether you believe in non-resection or resection or blending approaches, or you started out with Moore or Cosgrove or Carpentier. At this meeting, it all comes together, and I think it's impossible to be here for 2 days and not leave and go home and be a better mitral surgeon. Because I was just saying on the podium, I still remember talks I heard here a few years ago, and I go back and I adopt and change things. I'm constantly evolving my own practice in terms of how I try and repair the valve, and I'm pretty sure that's true for most of the audience.
I know, as you do at Mount Sinai, where you have surgeons come in, I think the ability of surgeons to interact with the faculty one-on-one, throughout the meeting is equally important to establish those relationships.
Randy, one of the things I learned from you many years ago is that the joy of collegiality and friendship and the bonds that you make in a live meeting that you don't necessarily get from a video conference. And this meeting in particular has such a buzz and interaction.
Really does.
And I think that it's not just among the faculty, but it's among all of the attendees. I think there's a real energy in the audience because everyone does feel like they're really improving as these 2 days go forward.
Well, you and your program committee and your New York team are to be complimented. I mean, this is unbelievable. Over your shoulder, we've got 1,300, 1,200 people in there, and it's just phenomenal. So congratulations. We got a full day and a half left of this, so it'll be good.
I was going to say, Randy, so far so good. We've still got a day and 3/4 to go, but I'm pretty proud of the beginning, and I'm looking forward to stumping you with a few questions during the case presentation phase.
Sure you will. Thank you, and congratulations. And thanks very much.
Thanks,
and
Randy.
we want you all to come back. There's a lot more ahead.